COVID on the coast. Want to get our weekly checkup with Santa Barbara County Public Health, and Dr. Henning Ansor joining us live here to talk about the latest updates on the pandemic. Dr. Ansor, thanks for being here.
Good to be here.
All right, so booster shots kind of in the news today. The FDA is meeting to discuss both Moderna and Johnson & Johnson over the next 2 days, and then they'll vote tomorrow. What do we know about these meetings, and is it expected that we're going to get the booster news that the White House is wanting to roll more shots out?
Yes, it is quite likely. We are anxiously awaiting the verdict, so to speak, from the FDA. They are evaluating all the data that the companies provide or did provide, and we'll discuss that in their, advisory committee. And we'll decide whether or not the Moderna and the Johnson & Johnson will get this emergency use authorization, just like the Pfizer did.
What about mixing and matching vaccines? A lot of people have been asking about that, as if you got Johnson & Johnson, can you go get a Pfizer dose right now if you're eligible?
Yeah, exactly. That is also really on the radar, and it should be discussed. There is some very recent study results that I'm sure will be discussed at length today and tomorrow at the FDA.
Vaccines for kids, also a huge topic. The FDA is still kind of waiting on this, and CDC approval as well for 5 to 11. When do we think the Pfizer doses may be eligible for that age group? A lot of parents are wanting to know. We kind of gave Halloween as a benchmark time frame. Are we any closer?
Yes, we are actually. There is a date now. It's October 26th that the FDA, again, the same as the boosters today, in 10 days, 11 days, they will review all the data for the child 5 to 11 vaccine of the Pfizer. And the following week, that will be the first week in November, the ACIP from the CDC will, providing the Pfizer gets the authorization, then the CDC will come out with recommendations, how to give them, how often, and so forth. So yes, it should be available if it gets approved once the CDC comes out with a recommendation for physicians.
Now, 12 and older is already eligible to get a Pfizer dose. Do we know the percentage of 12-year-olds to 15-year-olds that have gotten their Pfizer doses?
Yeah, it's around 25%. So it is not as high as we would like it to be. And we are constantly working with the schools and encouraging parents to go get their kids vaccinated.
What's the hang up? Is it people worry, because a much higher percentage of adults are vaccinated? Are they just a little more cautious with their kids, I would think?
Yes, they are. I mean, and as a parent, we all understand that you are very cautious and very careful in deciding what to do with your children. You have to decide for them, and we understand that is a big decision to make for parents. So they need to get educated. There is a concern about myocarditis as a side effect from the vaccine for young men mainly. So that has to be taken into account. It has to be discussed with their physician. But overall, I always want to tell parents that young men can get myocarditis from other viruses. So it's not unusual to get myocarditis in that age group. Older teenage boys and young men. So the risk for getting this from COVID infection itself is actually much higher than to get it as a side effect from the vaccine. So, so far the CDC strongly recommends for all kids 12 and above to get the vaccine. So the risk-benefit ratio is very much in favor of the benefit of getting the vaccine.
And real quickly, case rates in Santa Barbara County, where do we stand now? We seem to see a downward trend across the country.
Yes, and parallel in Santa Barbara County, we are seeing a very, very slow decline. It's almost like a plateau. We are still in the old purple tier, which is per CDC, a very widespread and high level of community spread of the virus. We still have so many people who can get infected by the virus because they never had it, so they don't have any natural immunity, or they haven't been vaccinated. So therefore, the virus is still spreading quite a bit. But fortunately, it's downtrending, but we are not yet in the clear.
Dr. Henning Ansor from Santa Barbara County Public Health Department, thanks for joining us here on Midday.
My pleasure.